Everybody. Today I'd like to introduce Dr. Bill Kellner-Read. Now, Bill is a holistic dentist. He's born in England, studied at the University of King's College in London, and achieved his bachelor degree in 1977. Dr. Bill is an author, and he first published in 2002, and public speaker, educating clients and professionals alike since 1984. So I guess that's where the lead into the author was, from the public speaking. Now, he has some other unusual interests, one being martial arts, and the other one is just looking down from everybody from the sky as a pilot. I think that's a bit of an interesting diversion from being a dental surgeon. So I'd say welcome to Dr. Bill Kellner-Read.
Thank you.
And how are you today, Bill?
I'm really well. Actually, I'm going to jump straight in there, if I may, before we start anything else. And when you said about flying being an interesting diversion from dentistry, if you think about it, dentistry is a fairly small space. Yes. And when you're flying, you see a great space. And I had something I always used to say. People would ask me my opinion, and I would say, well, as far as I can see. And realize that, of course, that is an axiom for me for life, if you like. So the great thing about flying is when you're up there, it really is as far as you can see, unless you happen to be flying in cloud. Whereas when you're working in the mouth, it's a very focused, very small area to be working in. So it's a great thing to be able to go from that very small area to the much wider picture, if you like. Yeah.
That's very good, because I was going to ask you, was there anything else you'd like to tell us about yourself? So that was excellent. Okay, so you've been a dentist for over 40 years. How has the profession changed in that time?
Okay. Look, obviously, fundamentally, dentistry hasn't changed a great deal in those 40 years. I mean, the basics are still the basics. Dentistry, like any other business, let's look at it from a business point of view just for the moment, goes through that same cyclical nature of things that are in vogue, they go out of vogue, and the next best thing comes in, and the next best thing, and the next best thing. Obviously, having done 4 decades of dentistry now, I've seen many things come in. I wouldn't say that I've seen many things go. What I see in my profession is there are continual additions to what we knew when I started. I think the things that have changed is science and the message that we have been giving and the medicine is giving. And I had this interesting conversation with my dad a few years ago. He passed away in 2005, but before then we were having a chat about the skin. And when he was a medical student, he was taught that the skin was an impermeable membrane. When I was a student, I was taught that the skin was a semi-impermeable membrane. And now I think we all know that the skin actually is a permeable membrane. And if you want to put something on the skin, you've got to understand that it can go through and into the rest of the system. And so those are the sorts of things that we see as changing within the profession. The whole movement away from mercury fillings has been an interesting one as well. And I think that is twofold. On the one hand, when I first started not using mercury fillings, it was because I didn't like the idea of putting mercury into the body. We know it's a neurotoxin. But of course, as the materials have developed, even those who didn't really have a problem with mercury-based fillings realized that a white filling looks nicer than a mercury filling.
Absolutely. Absolutely. So is it true that most disease, and I'll put it that way, is commonly found in the mouth to start with?
Yes, I think that's right. I think look at it in a slightly different way. And what we know is that a lot of disease is inflammatory in nature. And one of the biggest areas of inflammation is the mouth. And so that if we're not reducing the level of inflammation in the mouth, it's very difficult to reduce the level of inflammation elsewhere in the body. So that's how I look at it. I mean, the mouth for me is so much more. When we first looked at dentistry, I always joke about the fact that the dental textbooks would have a wiggly line just along the neck, showing that we dealt with this bit, but there wasn't a body below it. And my goodness, what an amazing thing it was when I found out there was a body attached to the head and neck. And so, you know, we have really not looked at the mouth in as much detail as we are now as a profession. And then it was about straight teeth, it was about clean teeth, it was about pain, it was about pain management, all those, and replacing orthotically things that were missing, dentures, and so on and so forth. Now, you know, with the introduction of things like, we've moved right through, and this is what I mean about this approach to dentistry, we're now very much involved in something like sleep medicine. So there's a massive input that we have into sleep medicine. Therefore, we're looking at children with, or infants with breathing difficulties, where we realize that the mouth and the whole complex has so much to do with whether they're breathing, whether they're not breathing, whether or not infants are actually having sleep apnea, and whether as a result, and they are. And this is, so, you know, when we think of a child not sleeping well or waking up in fright, you know, some of it may well be that we're looking at people who, or children who have a poor airway, who are breathing through their nose, not breathing through their nose, they're breathing through their mouth, and therefore they go through those same periods of time where they just stop breathing altogether. And if you think about that, that's a pretty horrific thing to wake up and realize you're not breathing as a child. So, yeah.
Yes. Yeah, absolutely. So what are the most relevant challenges that patients are facing in today's fast-moving world?
Wow, this is a good question. What are they facing right now? I think in the fast-paced life that we have, we tend to ignore the mouth. I think that's the first thing is, you know, you brush your teeth twice a day and you hope that everything's going to be okay. But when we look at the mouth as part of the rest of the body, first of all, we know that when we get stressed out, our inflammatory levels go up. That's understood. But we also start to understand what can break down within the mouth, because people are turning to more alcohol, more smoking, more recreational things, very simply because they can't cope with the pressures of life. And what we're doing is we're using substitutes for good old rest and relaxation, for kicking up over a weekend. You know, we're not kicking up over a weekend. We pick up one of these, we turn it on, we scroll through Facebook until we can't scroll any further. Then we put that down, or we hold it to our ear, and we wonder why we're all starting to struggle. So I think that, you know, when I look at it from a holistic point of view, rather than just the mouth, it's that we're increasing our levels of stress, but we have not increased our ability to cope with that stress.
Okay,
and that's
right.
the issue that I'm seeing.
Okay, so you mentioned the holistic point of view. So when did you make the move to a more holistic point of view, and the reason for that?
Okay, there are two things that happened. I was in practice for about 3 years, and you know, I've got amazing focus. It goes everywhere, and so I was in practice for about 3 years, and I looked at it and I thought, gosh, there's got to be more to life than this, and I needed to find something of greater interest within my job. And this is something I would advise any young dentist who, if they ask me, is to say, what do you really, really enjoy in dentistry the most? Because whatever that is, and this goes for life, what do you really, really enjoy most in life? What's the desire of your heart, if you like? Find that and then build on that. So for me, I was in my practice and I would get incredibly irritated by patients not turning up for their appointments. I was running my own business, and every time they didn't turn up, it cost me money, if you like.
Yes.
And I wasn't as laid back as I try to think I am now. And I get very irritated. Now I'm having a chat with, you know, and a patient will come in, I said, well, sorry, but you missed your appointment last week. What was the problem? Oh, I had a headache. And I'm thinking, so, you know, don't we all get headaches? I used to get one every Sunday morning after playing rugby on a Saturday. Nothing to do with the beer. But anyway, so I had a chat with my dad about this, and I said, look, you know, what are you doing about patients' headaches? And he said, well, you know, we have some answers, but we don't have enough. And I remembered in dental school that we had maybe a half hour or an hour lecture on headaches. That was about it. But I was fascinated by headaches, and I became even more fascinated by them when I ended up for 3 weeks in the Brook Hospital in London with a headache. And that was really the turning point for me, because it allowed me two things. One was to really experience a really bad headache, that nobody really had an answer for. They came up with all sorts of answers, but there wasn't really one that fitted. And it gave me the understanding of other people. And when patients then came in and said, well, you wouldn't know what it's like to get a bad headache. And I go, I really do know what it's like. And that started me looking at headaches, started treating headaches, head, neck and back pain of dental origin. And of course, the moment you move into that side of dentistry, which isn't what we think of as mainstream, then you start to look at all the other things that could possibly be making people sick. You know, were mercury fillings a real problem for people? You know, back then we weren't really looking at gum disease being linked to heart disease, to diabetes, to stroke, to preterm low weight babies. We didn't know in those days that, and this is a fascinating fact and something that really concerns me. I didn't realize until just recently that 1 in 8 babies are born with some sort of heart problem. And here here I am looking at research that shows that the bacteria that cause inflammation and problems in the mouth is actually found in the placenta.
Really?
Yeah. So now it's not, and so that bacteria or that inflammatory process that may be causing that, I'm only speculating. This is not the research, so please don't think that I'm just speculating, because the great thing about being a practitioner is the idea of putting stuff out there. It may be true, it may not be true. But how about we think about the fact that if we're finding this bacteria in the placenta, does that mean that actually what's happening is that that's somehow affecting the baby? Now, from my point of view, that would be the argument for those people, husbands and wives, men and women of childbearing age, should be having a free dental clean every 3 to 6 months. And it should be free. Because when you think that through, and I'm only saying if, I'm not saying it is the case, but if there is a chance that this is causing harm to this child, think not only of the impact on the family, on the child and the family, but think of the massive financial implication of a child that's born with some sort of cardiovascular problem, who is having to have medical treatment throughout their lives. Wouldn't it be easier to say, how about we just throw some money at free cleans, because you're of childbearing age, no problem, understand it, let's keep you inflammation free if we can, because we're looking after the future next generation.
I've actually had a very personal experience with that. I raised my niece, and she was born with what they call a long QT syndrome. And it showed up in her mouth, but we didn't realise the full implications until it was too late. And she died at 6 because they collapse and just die for no apparent reason. But it's an electrical issue, not so much anything else. But yeah, I've had a very personal experience with that, so I can reiterate on that very well. Yeah. Okay, so you've written some books.
Yeah.
Would you like to tell us about them?
Okay.
And also, where can we get them?
Yeah, well, some of them you can get from me, and that's just, and I'll tell you that in a minute. The first one, as you know, was I wrote for Credence Publications, so that was published by Philip Day.
Yes.
I think there are still some copies with Philip, but of course I also have it as an ebook. It's not an ebook that I necessarily send out unless people would like to request it, and then there's a small fee for that, and they get the book. But what happened was I met...
Sorry, Bill, I was going to ask, would that be like Toxic Bite?
Yeah, Toxic Bite.
Yeah, okay.
So what happened was I was at a meeting in Guildford, and I met Philip Day for the first time there, and we were chatting away, and he said, have you ever thought of writing a book on holistic dentistry or toxic dentistry or whatever you want to call it? And I said, actually, I'm in the process of writing one. He said, would you like to write it for Credence Publications? I said, yes, I'd love to. And so I wrote that. It was edited by Philip. Steve Ransom did the cover, and that came out in 2002. Really what I was doing was giving the research that I found on the different aspects of dentistry. So I looked at mercury fillings, I looked at its history, I looked at the fact that we know that mercury is a neurotoxin. I looked at fluoride and the whole issue around fluoride, which is a difficult one, because most people believe that fluoride is good for you. Most people have been told that it is, and I'm not here on this call today to dispute the findings of the dental profession. All I'm saying is that when you look at some of the other research out there, and when you look at, if you go to fan.org, which is the fluoride network, you'll see that actually there's a lot of arguments that suggest that fluoride may not be particularly good for us. So we have the two sides there going on. So I talked about that in the book. Again, not my opinion. That my opinion is worth, just what it's worth. But in terms of, I hope that's not my phone, it's probably my daughter's. So in terms of the research at that time, and the reason I got into fluoride, interestingly enough, just before I went to university, and I wrote this in the book, there was an article in the Times newspaper in 1973. That's before you and I were really born, Joan. But in 1973, there was an article in the Times newspaper looking at fluoride, and I just read this and I was in horror, and I hadn't even started at dental school. So having read it, you can bet your bottom dollar I wasn't going to use a great deal of it, and I've researched it extensively since that time. We also looked at root canals. I don't really want to go into that. What I will say about root canals is if you have them done, we have some extraordinarily good endodontists, those are the specialists who do root canals, and their work is exquisite. So that if you have to have them done, I refer to my local endodontist very simply because they're so very good at what they want. If somebody wants to keep their teeth and that's their choice, then my job is to make sure I find the best person to do that job for them, and I do. And I'll give them a plug now because I tend to use the endodontic group. They're based in Brisbane, but they're also on the Gold Coast, Sunshine Coast, and they're extraordinarily good, very nice people as well. But there are other endodontists around extremely good as well. So I looked at that. The other area that was really important, and this all comes in Toxic Bite, was very relevant to me, was growth and development. And actually, when I first came to Australia, and I looked at how do I put this politely? So, I had some children coming in from the outback, and some of them were quite bizarre. And I wondered what on earth was going on with these children. A very interesting growth and development. And it took me to look at things like pesticides, crop spraying, which is much bigger here, obviously, in Australia than it is in the UK. Where does the spray end up? And on somebody's roof, they're drinking tank water, and so we have some issues there. We have they have endocrine problems and so on and so forth. So I really looked at growth and development. And from my point of view, what dentistry can do is it can expand the upper jaw, bring the lower jaw forward, so give a better breathing, get children breathing through their nose, get the tongue sitting up into the palate, get the airway really good so that they can grow and they can develop properly. And this was something that I'm, as you can hear, quite passionate about. And so I talk about that in Toxic Bite because, once again, I want to give this overall idea. I want people to understand the dentists are not horrible, scary people, but the majority of them, they're there doing what they do to the best of their ability, and that varies. But, each one of us who has a belief in what we do, we want to give the very best that we can. So from my point of view, it was looking at structure.
Okay.
Structurally okay. So I work with chiropractors, osteopaths, physiotherapists, body workers in general. So I look at structure. And that includes the airway and children who get ear infections, have to have grommets in their ears, gets tonsils and adenoid problems. We look at all of that sort of thing in terms of growth and development. We look at structure. We look at toxicity. We look at the water that we're drinking, the quality of the water that we're drinking. Are we drinking enough water? Are we getting hydrated, or are we dehydrated? And where do you see dehydration? Oddly enough, we often say, oh, I have a dry mouth. That's actually one of the last signs of dehydration. We're already very dehydrated by the time we have a dry mouth. And as we get older, we don't even notice we're thirsty in the first place, unless somebody offers you a beer, a gin and tonic. So we looked at that. And then I looked at nutrition. So that also in Toxic Bite, this is an overview of nutrition. And it was a guy by the name of Weston Price who said, we've known for 40 years or more that physical degeneration causation is largely nutritional. So that means that if we're not looking at good nutrition, we're really missing the boat in terms of what we can do for our children. And what he found when he came into Australia was that he found that the Aboriginals of Australia were the finest specimen of men and women. This was back in the 1920s and 30s. So that as we unfortunately have changed their diet, or they have changed their diet to the one that we have, they can be as sick as we are.
Okay.
All of that is covered in Toxic Bite.
Okay. Good.
I moved on from there, wrote a book called Chill Out. It started off with another name, which was Bucket Full of Stress. And really my whole emphasis of my practice is about stress. What I needed was a model to work by. And it was Hans Selye who said stress is the non-specific reaction of the body to any demand placed upon it. So as you place demands on the body goes from ease to dis-ease. But what you find is as you reduce the stresses on the body, then the body can come back and function more normally. So from my point of view, I may not be able to deal with something going on in somebody's home, but if I can balance their bite and reduce that stress within the system, I may give them a better coping ability for another area of their life.
Okay.
And so Chill Out was very much about all those different areas and who you go and see, who works with who, and so on and so forth. And that's why I wrote that.
Okay, cool. So what advice would you give to young parents today for their children's oral health on an ongoing basis?
Okay. I'm a great believer that children should see a dentist as early as possible. There's a lot, I talked about the cyclical nature of dentistry as life in general. One of the things that now is taking a lot more interest within the profession is tongue tie. And tongue tie is not always being noticed, and that's where the tongue sits down and is held by a little piece of skin underneath the tongue down onto the floor of the mouth. Mums will often recognize that, they won't recognize why, but often if a baby can't latch on for breastfeeding, it may well be because they're tongue tied and they actually cannot latch on properly, or that the attachment underneath the upper lip is stopping them from latching on. So that's something that mums need to look at very early on. So we like to look at that and make sure that that's not a problem. I like to see children early, especially if they have ear infections, glue ear, that sort of thing. That I want to make sure that they're growing well within the head, within the head and the neck. So those are the important things. The other things are obviously toothbrushing is important, diet is important. Toothbrushing, I believe that you've got to understand your children. We are not all as dexterous as each other. There are a lot of people I would never ever let pick up a drill and put in my mouth. Fortunately, I'd let me do it because I'm very dexterous. And you need to understand that children are not, look, my younger sister, bless her little cotton socks, but she would pick up a fork to put it in her mouth. Somebody would say something and she'd go, yes. And the fork would go in her ear with her food. Now, I'm not saying that means she's not particularly dexterous, but it certainly shows a slight lack of focus when it came to putting the food in her mouth. And so you need to understand that for your kids. That help them with their toothbrushing is it doesn't work to come into the practice and say, well, I told them to brush their teeth. And then I say, well, you're not brushing your teeth particularly well. And they go, oh, well, I told them to go into the bathroom and brush their teeth. No, if you're the parent, you look after that. You do that for them. And you make sure that the job is done. It's your responsibility. And there is some suggestion that you should go on helping your child brush their teeth until they're at least 8 years of age. Now, I know they get irritated. I have children of my own. They're all grown up now. But I know they get irritated. But this is so important. Teach them how to brush. Understand that you're not just getting them to brush because it's nice, sweet breath, but you're reducing their risk of systemic disease later on. Okay. And I do, Joan, have a book called Peter and Petunia. I should have had these books so I could show you.
Yes, I actually have that I've given to one lot of my grandchildren.
Oh, okay. So Peter and Petunia was written, my oldest daughter is a tooth fairy. She goes around Queensland teaching children at kindies on toothbrushing techniques and so on and so forth. And good foods and that sort of thing. Anyway, so she asked me to write a book, which she she takes around when she goes around. She reads that to the children. But that book is available. And the thing about the book, yes, it's a little story about Peter and Petunia, and you know, that Peter doesn't like to brush his teeth, and Petunia does. And I wasn't being sexist here, you know, it's just the way that I see the world. And it's what happens to Peter and how we work that thing through. But the most important part of the book is actually there's a message for parents in there. And it's the message for parents that I really want to get across, so that you understand your responsibility and why it's so important for your children that we help them in that way. Joan, I'll let you have links for this so that we can, you know,
Okay.
who would like that, and
Yep.
because I've taken my website down to redo it, so I'll need to just let you know how those could be. How people lay their hands on those books. Obviously, with the Toxic Bite, it's still available through Credence, but if people want an ebook, then that can be arranged through me as well.
Okay, cool.
You look like you got oh, there you go. You look like you had a white moustache there. There you are. You got a moustache.
No, I had sun coming in through my office window. I had to get up and pull the blind down because it was in my eyes. So I figured that it wasn't a good look, that end. So anyway. So what's the most important things that someone can do to look after their dental health? What's like the daily things they can do, or what do they need to look for?
Okay, I think the first thing, with all the research and so on that I've done, let's look at toothpaste. And when you look at toothpaste, there are a lot of toothpaste on the market that have dubious qualities. And what you really want are two things that I think in a toothpaste. One is that there are no toxic ingredients in the toothpaste. And if you read the labels on some toothpaste, you'll see it says, if swallowed, go to the poison center. Well, I don't know about you, Joan, but when I was a boy, toothpaste was just another mint I would eat, you know, and I would brush my teeth with it, and then I'd take a fingerful and stick that in my mouth, and that would be something else that I would have, because I didn't know that there could be any toxic ingredients in there. But there are, and for various reasons. And so what I've done is I've looked at products out there, and there are a couple of companies, as you know, that have a product that's not only got non-toxic ingredients, but also has an active ingredient. And the active ingredient is antium dioxide, or stabilized chlorine dioxide. And the thing about this is that it actually does something. Most toothpaste just make you feel better. But if you have something that actually actively works within the mouth, that actually breaks down the biofilm, actually breaks down the volatile sulfur compounds that cause bad breath, then why not have something that that goes that far, and drop a mouthwash in with that of the same products. And I know that you can get your hands on those sorts of products, Joan, and I would recommend those as something that people look at, and especially if they're people who get things like mouth ulcers. You know, people go, oh, I get these dreadful mouth ulcers. Well, look at your toothpaste. Yes, look at your stress levels, but also look at your toothpaste. Have you tried changing your toothpaste? I have a patient right now, and she's got down to one toothpaste that she can use. The rest of them actually cause the mucosa, the skin on the inside of her mouth, to separate from, you know, and slough off. And she finds it incredibly painful. So obviously I'm going to introduce her to what I know. But up until she met me, she didn't have another answer. She just kept trying to find something that wouldn't harm her.
Okay.
So very, very important.
Anything else?
So we've done mouthwash, we've done toothpaste. Something I get asked a lot is type of toothbrush. Look, there's a lot of research out there to say that electric toothbrushes are the way to go. To be honest with you, if you don't use a toothbrush correctly, it doesn't matter whether it wiggles, whether it squirrels, does whatever, it's not going to do the job. So 2 pieces of advice on toothbrushing, and this goes for adults as well as for children, more for adults if you like, is toothbrushing is a habitual thing. So if you miss something once, chances are you will continue to miss it. And so oftentimes I'll see that patients, I can tell you whether you're right or left-handed, by the way, by looking in your mouth. Yeah, weird, isn't it? And the only reason, it's nothing special, it's just that my observation is that most people are better at the forehand with their toothbrush than they are with the backhand. So with a right-hander, the right side of the mouth tends not to be as brushed as well as the left-hand side. For a left-hander, it's the other way around. So it's a little trick, you know, and people go, oh, how do you know? And I go, well, now I've told the world, of course, our secret. But the point is this, if that's the case, break the habit by using your non-dominant hand for a certain time while you're brushing your teeth.
Okay.
Because apart from the fact that it then comes under conscious control, so now you have to think about what you're doing, otherwise it's going to go up your nose or in your ear, whatever. You're also going to brush areas of your mouth that your habitual way may have missed. And that way you stand a much better chance of getting to every single tooth. Absolutely, especially as we get older, flossing is really good. Pixters, those little toilet brushes, I don't mean that, that's what I was doing. Thank you. They're tiny and they work very well for people who start to get gaps between the teeth as well.
Okay, cool. So do you have any other areas of health that you have an interest in?
Sorry, now that I missed that. Pepper, off you go. That's the dog. Yeah, ask me the question again.
So what other areas of health do you have an interest in?
Oh, wow. Well, all of it really. But I think that if I look at over the years, I've been particularly interested in the effects of toxins on the body. I think that's probably the thing that I've really, apart from stress is my best, stress is my thing. So, you know, if I'm going to go and stand in front of a room of people and talk, I want to talk about the issues of life. I want to talk about stress, the impact that stress has on the whole system. But I want to go further than that. I want people to start looking at the various areas of their life that are not particularly well balanced. And I know all this because I'm one of those people who dedicated my life to dentistry and haven't always spent enough time at home or going flying, all those sorts of things. So that's the thing that I find fascinating and have researched extensively. But then one of the things I realized was that toxicity is such a massive problem. We talked right at the beginning about the permeability of the skin. Yeah. So, you know, people are not thinking about the type of shampoo they're using. They're not thinking about the type of face cream they're using. They're not thinking about the things they're putting on the body and realizing that can have an effect on them. They're not thinking about the fact that whatever goes into the mouth can be taken in through the mucosa underneath the tongue and straight into the blood system. They're not thinking about those things. And then they wonder why we wonder why we get sick. And the answer is because we're just doing the very basics not very well. So that it's important to align yourself with products, if you like, that are going to be healthful to you and get rid of all the toxins. As you know, I'm very much into water, and that goes back to 1973 when I read the report on fluoride. Obviously, you know, they're putting this into my water supply, and I want good, clean water. I want to have it filtered. I wanted something that was amazing about water and the research is just coming out. In fact, it didn't start that long ago on the level of molecular hydrogen within water. So I've looked at different gases in my profession. Nitric oxide took a great deal of my interest when I was looking at L-arginine, looking at nitric oxide and its ability to cause vasodilation. That came about because I had a patient who was diabetic who came in to see me and told me he had a problem. He got a new girlfriend. He was in his 50s and he couldn't get an erection. And he said, have you got some answers? But I said, well, I'm your dentist, you know. But he still knew. He said, no, but you've got an answer, haven't you? And I said, yeah, let's look at, and we looked at L-arginine, we looked at nitric oxide, the nitric oxide cycle and what that can do. So this little gas was doing such amazing things. It does such amazing things within the body. So we know we need to have that within the system. Oxygen we all know about, carbon dioxide we all know about, and now medicine is looking at molecular hydrogen. And they're finding that molecular hydrogen is probably one of the best antioxidants that we can naturally take in. So we take it in our drinking water. If you have something that will make molecular hydrogen, you take that in and that will actually mop up free radical damage, but very specific. Unlike some of the other antioxidants we use, molecular hydrogen is very specific in its nature and what it can do for the body. And there are links now, if you look at research into Alzheimer's, into or you know, things like chronic fatigue and so on and so forth, things that we've been struggling with, forms of dementia, where we're now finding that, you know, get some good stuff into them, and that will be a combination of molecular hydrogen, but also just hydrating the body. You know, 2 to 3 liters a day minimum.
Yes, yeah, and I think
good quality water.
Yes.
Yeah.
So, anything else you would like to talk about today?
Oh, how long have you got?
No, just a little bit longer.
Okay. Yes, so let's just come back to I suppose the relationship that I've formed over the years with chiropractors, people like Ross, who you know, Ross Harty, clinical nutritionist. Why would the two of us work so well together? Why is it that we've toured together and done, a full day seminar between us? Very simply because we realize that we only have a part of the puzzle. Mm-hmm. And so Ross and I, when we work together, or Michael Troy, a good friend of mine, is a chiropractor here in Brisbane, we work together because I have a part of the puzzle. I wish I had the whole puzzle, but I don't. But I know I have a very important part. And then when I work with Ross, for example, I'm saying, okay, you need to look at this. And Ross will go, oh, yes. And because you need to look at that, you need to look at that. So he comes in from his point of view. And then I come back in with my point of view. And we talk and work through each other because of something that I call interprofessional generosity.
Yes.
See, the important thing is not what I can do for you, but is what somebody else can do for you. I know what I can do for you. But it's recognizing when you need somebody else. And a good friend of mine who taught me a lot about what I do is a chiropractor by the name of Bob Walker. And years ago, we were all working on the body structurally. So I would work on the bite and I would balance the bite and get rid of people's headaches. And that was great. And then, but I didn't get everybody better, and that's understandable. And then the chiropractors were doing the same. And then the podiatrists were doing the same. They were also, doing their thing. And then Bob comes in and says, okay, let me tell you when it's the chiropractor's turn first, when it's the dentist's turn first, and when it's the podiatrist's turn first. That was amazing revelation, because all of a sudden I'd look at somebody and go, look, I'd love to treat you, but actually before I start, would you mind going and see the chiropractor? Because I need their opinion and I will work with them. Or the podiatrist. Is the problem coming from the head down to the feet, or is the problem coming from the feet upwards?
Yeah.
I looked at a young girl the other day with daily headaches. And can I help her? Yes, I can. But I stood her up and her feet are rolled in, and she gets a lot of knee pains, which has been put down to growing pains, but no, her feet are rolled in, her knees are rolled in, she gets hip pain because now the hips aren't exactly where they need to be. The pelvis is unbalanced, the rib cage is going the other way, the shoulders are going the other way, the skull's all askew, the bite's not right, and the poor girl, she's struggling. But what we can do is put that back together by working together. And that's the generosity that we need between the professions, saying, I can only do this much. And that's where Ross and I work so well, because I say, Ross, I know a bit about nutrition, but you know a lot about it. And he goes, Bill, you know a lot about what you do, and I know little, and that's how it works.
Yeah, he's very good at what he does. I just wish to thank you for your time today. Now, can I put a little plug in here as well? And first off, where can people contact you? We're going to get some information so we can put up on the site.
Yeah.
After this, you're going to send that to me? I'll
send that to you where I'm working. So I'm doing a couple of days a week at the moment at TFI on the Gold Coast, which is in Labrador. It's 1-84 Brisbane Road, Labrador. So that's where I'm a couple of days a week. Just need to look up TFI Labrador, the Gold Coast, and you'll find the practice. And that's where I'm working from at the moment. We also have a great seminar facility out of the back there. Should we at any time want to do a seminar, we have our own seminar facility as well.
Excellent, because I was actually looking for a venue last week, which we didn't get to put it together, but I will definitely keep that in mind. Now, I'd just like to announce an event that we have on this Saturday, so the 13th of July, and it's at the Zillmere Hall, 52 Murphy Road, Zillmere in Queensland. Parking's in Merritt Street. Now, it's for 1:15 for a 1:30 start, and it goes till 4 p.m. Now, if you want to come back to us for some information, we'll give you how you can reserve your seat. Now, if you're really lucky, as far as I'm aware, Ross Harty, the clinical nutritionist that we've been talking about, will be in attendance. And I've actually sent Bill the link that maybe if Bill is not busy and can afford a little bit of time, Bill might even turn up on the day. So I thank you very much for your generous amount of time that you've given us today. And we will be in touch.
Wonderful. Thanks so much. I really enjoyed that. Thanks for asking me on.
That's my pleasure. Okay.
Bye
thanks.
for now.
Bye.
Bye-bye.